What are the potential risks and complications associated with surgery for grade 3 hemorrhoids?
Hello everyone, and welcome to today's video. In this segment, we will be discussing the potential risks and complications associated with surgery for grade 3 hemorrhoids. Hemorrhoids can be a source of discomfort and pain, and in some cases, surgical intervention may be necessary to alleviate symptoms and improve quality of life. However, as with any surgical procedure, there are potential risks and complications that need to be considered. Let's dive in and explore them further.
What is grade 3 hemorrhoids?
Before we delve into the risks and complications, let's briefly discuss what grade 3 hemorrhoids are. Grade 3 hemorrhoids are classified based on their severity and protrusion from the anal canal. They typically protrude outside the anus during bowel movements or physical strain and require manual reduction to push them back in. At this stage, they are more advanced than grade 1 and grade 2 hemorrhoids and may cause significant discomfort and bleeding.
Risks associated with surgery for grade 3 hemorrhoids.
While surgery for grade 3 hemorrhoids is generally safe and effective, there are certain risks involved. It's important to remember that these risks vary depending on individual factors and the specific surgical technique employed. Some potential risks associated with surgery for grade 3 hemorrhoids include: 1. Infection. As with any surgical procedure, there is a risk of infection at the surgical site. Precautions are taken to minimize this risk, such as sterile techniques and antibiotic prophylaxis. 2. Bleeding. Hemorrhoid surgery can involve cutting or cauterizing blood vessels, which may lead to bleeding during or after the procedure. However, significant bleeding is uncommon and can usually be managed effectively. 3. Pain and discomfort. Following surgery, it is normal to experience some pain and discomfort in the anal region. This can be managed with pain medication prescribed by the healthcare provider. 4. Urinary retention. In some cases, surgery for grade 3 hemorrhoids can result in temporary difficulty in passing urine. This is usually a transient issue that resolves on its own or with medical intervention. 5. Fecal incontinence. Although rare, there is a small risk of developing fecal incontinence after hemorrhoid surgery. This is usually temporary and resolves over time.
Complications associated with surgery for grade 3 hemorrhoids.
While complications are relatively rare, it's essential to be aware of their potential occurrence. Some complications that can arise after surgery for grade 3 hemorrhoids include: 1. Anorectal stricture. In some cases, scar tissue formation after surgery may lead to narrowing of the anal canal, resulting in anorectal stricture. This can cause difficulties with bowel movements and may require additional treatment. 2. Fistula formation. Fistula formation, although uncommon, is a potential complication of hemorrhoid surgery. A fistula is an abnormal connection between the anal canal and surrounding tissues, which can cause discomfort and infection. 3. Recurrence. Despite the surgical intervention, there is a possibility of hemorrhoid recurrence. This can be influenced by various factors, such as lifestyle choices, underlying medical conditions, and the specific surgical technique used. In conclusion, surgery for grade 3 hemorrhoids is generally a safe and effective treatment option. However, it's crucial to understand the potential risks and complications associated with the procedure. Remember that the risks can vary depending on individual factors and the specific surgical technique employed. If you are considering surgery for grade 3 hemorrhoids, it is important to consult with a healthcare professional who can provide personalized advice.